and then reach down from there. And then you can just keep them in that position, and that adds a little bit more intensity to the whole thing as well. So you could do that. And I'm just working down the neckline through to here. A little bit of rotation and lateral flexion. There you go. Awesome. And we go into the neckline.
Are you still on the same muscles, still on the scale?
I've moved a little bit onto the one front, but I'm just using my fingers and working through. We can now go in with a nice forearm glide. And down. So a forearm glide works really well. Now this is grabbing. We've not really talked about it. It doesn't really matter because this is really a good way of treating. But we're now moving across trapezius and levator scapula in this position. And we could come into trapezius and levator scapula. I could drop my elbow into there. How does that feel?
That's great.
And it works really well. So you are now bringing the fibres forwards from the back. But that's the way the shoulders are going anyway. So it's not really.
So that's the way the muscles, that's the fibres are going.
Yeah, because the fibres, the trapezius muscles, they come into here, and they'll go onto the scapula, but also then round to the clavicle. So they fan around, and you can see that you're just rolling over the top of them and pushing them forwards. But they pull the shoulders forwards. So then I'll come from this direction. We can go from here, a little bit of pressure from the back, and just move across it transversely and push them back. And that's a really nice addition for trapezius muscles, which do tend to pull forwards. Does that feel? Because I can hook into the trapezius muscle there, and just work my way through. It gets pretty intense. You okay? It's been quite a lot of pressure coming into here. But what this sets you up for is then your transverse, your soft tissue releases, is that we could then mimic the problem. So if you are having difficulty looking over your shoulder when you're driving, what I want you to do is to rotate and add a little bit of twist in there as well and look over your shoulder. So can you feel how that would pull on a restriction and then come back to center? This is what you have to do when you move into your level 4, is think about the problem from your assessment. What's the limitation? Mimic the limitation and try and improve their range by sensing where that tension is and stripping it down. There's something good there. Keep on going. If you had a little bit of chin to chest as well. Yeah. Nice. Just do a little bit of petrissage on the neckline. Ease it all out. Massage down with both sides. I need more. I've got literally no oils on. This must be quite frictiony, but I didn't want to break the flow. And really, because it's going quite deep and quite slow, we don't need that much oil on. And I feel like actually less oil is probably better in the neckline.
Oh.
Yeah. There's a good one there. I'm working my way through. So I've basically frictioned and compressed it. That's all I've done, with a very, very basic set of effleurage strokes into it. But I think that's quite intense, and I don't know how long that's probably about 10 minutes of just doing like side lie and seated. There's something there that I just want to get into. Here we go. So that's the 3 positions for the neck. You've got prone, side, and seated.